Assalamualaikum. My name is Putri Sakina binti Syaridan from CS 2486B with student ID 2019111743.
Hi and Assalamualaikum. My name is Sharifah Wanwazir binti Said Azri. My ID number 2019722651.
Hi, my name is Siti Sarah binti Muhammad Nazir from CS 2486B. My ID is 2019367403.
What is the meaning of COVID-19? The COVID-19 words have the meaning where CO stands for the corona, VI for the virus, D diseases, and 19 refer to the year that the virus have been recognized. It's spread by direct contact with an infected person, respiratory droplets which are generated by coughing and sneezing. Achoo! The virus will spread more easily after people touch their nose and their mouth with their bare hands. Until now, the virus still dominates the world, in which more than 5 million people have been infected and more than 0.3 million lives have been lost in worldwide. This shows that this virus is really dangerous and kills people's life. Problem statement. First, the pandemic of COVID-19 puts immense stress on everyone in this world because everyone has to stay at home and control movement outside the house. Based on the statistic, the unemployment rate in Malaysia increased last year, which is 2020, because of the impact of the MCO. Second, today, many forecasting techniques have been used to predict and estimate the future cases of COVID-19. The forecast may not be accurate as there is always a risk associated because the cases in Selangor keep changing whether it is increasing or decreasing. In our study, we have 3 objectives. First, to apply the Box-Jenkins method towards data of positive, recoveries and death incidents of COVID-19. Second, to identify the best model in Box-Jenkins method, either ARIMA or SARIMA, models in forecasting the COVID-19 incidents using AIC, BIC and Durbin Watson. Lastly, number 3 is to forecast the future positive, recovery and death incidents of COVID-19 based on the selected best model. In this section, I will explain on significance of the study and benefit of the study. Significance of the study. The forecasting knowledge is needed to estimate and forecast about the future positive, recovery incidents, and number of deaths. One piece of knowledge for forecasting method is using the Box-Jenkins method, since it is suitable to forecast a large amount of time series data. Benefit of the study. The study will help health staff by locating and marking the hotspot that can cause the incidence of COVID-19 increases time by time, so that the place will be supervised strictly by the frontliner in ways to break down the change of COVID-19 in Selangor State.
Scope of the study. First, focus on forecasting future positive, recoveries and death cases of COVID-19 happen in Selangor State. Second, the data are gained from legal data provided by the Ministry of Health, which start from September 2020, which is last year, until April 2021 this year. Third, the method will be implemented to conduct this study is the Box-Jenkins method that is usually used for forecasting time series. Limitations of the study. First, the accuracy of this study will depend on the accuracy of the data used. Second, since the data will be used in secondary data from Ministry of Health website, the probability to get inconsistent results is high due to limited data.
Methodology. In this section, it will cover how the Box-Jenkins method used to evaluate it to find the best model used for forecasting the positive, recoveries and death cases of COVID-19 in Selangor. Let's start with the positive incidents. The data used was secondary data collected from the Ministry of Health Malaysia's website. The first step is to determine the pattern of this data by using the correlogram. What is correlogram? Correlogram used to check the randomness of the data. We can see that the data is only decay to 0 and we can assume it is non-stationary for ARIMA model. Then, to confirm its stationarity, use the augmented decay fully unit root test or known as ADF test. This test shows that it is non-stationary since the p-value is more than 0.05. So, we need to perform first differencing to make the data series stationary. After performing the first differencing, the ADF test shows it is already achieved stationary where the p-value is less than 0.05. And based on the new choreogram, we get ARIMA 414 for estimation of parameters. How we get this? By looking at the new choreogram, there are 4 significant spikes in ACF that will represent the AR value. Meanwhile, for MA value, we get 4 significant spikes too. By this, we can move to the next step, which is selecting best fitted model. For this step, there will be involvement of ACF and PACF. The simple assumption by looking at the significant spike before this, it is not always accurate to be the best fitted model. Thus, several possible models of ARIMA will be specified and tested. The models are ARIMA 111, ARIMA 212, ARIMA 311, and ARIMA 312. The characteristics to choose the best fitted model are: number 1, no serial correlation in the Durbin Watson test with range from 1.8 to 2.2. And number 2, has the lowest value of AIC and BIC. By all these characteristics, ARIMA 111 will be chosen as the best fitted model for forecasting the positive incident. Next, we will move to recovery and death data. The same step will be applied for this data, but instead of using first differencing, we use seasonal differencing. Why? It is because the choreogram for both data show a wave-like pattern. By this pattern, it is known that both data are not stationary and need to undergo the seasonal differencing to make it stationary. After that, check the choreogram and ADF test to see if it already stationary. If yes, we can check the significant spike at the ACF and PACF to determine the value of AR, MA, SAR, and SMA. The S in SAR and SMA stands for seasonal. So for recovery incident, we get SARIMA 9011-211, and death incident we get SARIMA 202-312. As mentioned in positive incident, there will be involvement of ACF and PACF. The simple assumption by looking at the significant spike before this, it is not always accurate to be the best model. Thus, several possible models of SARIMA will be specified and tested for diagnostic checking. These are the models for recovery incidents, and these are the models for death incident. By all characteristics mentioned before, SARIMA 101-111 will be chosen for recovery incident as the best fitted model, and the death incident, SARIMA 103-211 will be the best fitted model. This model will be used to forecast the COVID-19 cases in Selangor. The result of forecasting will be presented by Sharifah Wano Azri.
I will present for the result and discussion. In this section, I will show the forecast result for 3 incidents of COVID-19 in Selangor State, which is positive, recovery, and death incident. I will present you and explain it one by one. I will discuss about positive incident of COVID-19 in Selangor State. As we can see from the graph, the pattern of actual data in the blue line show inconsistent pattern, while the pattern of forecasting data in the red line show increasing pattern, same as the current scenario of COVID-19 cases in Selangor State, where the positive incident keep increasing day by day. The actual data we had gained from September 2020 until April 2021. For forecasting, we had decided to use the best selected ARIMA model, which is ARIMA 111, for forecasting 3 months forward, which is from May 2021 until July 2021. Next, we will discuss about recovery incident of COVID-19 in Selangor State. From the graph, we can see the actual data shown the inconsistent pattern, and forecasting data also shown the inconsistent pattern. We can say that recovery incident really correlate with the positive incident, as we know that when the positive incident higher, recovery incident also be higher, since it really correlate with each other. And the forecasting for the recovery incident in Selangor State had been made by using the model SARIMA 103-211-12. Then we will discuss about the incident of COVID-19 in Selangor State. As we can see from the graph, the actual data in the blue line is shown the inconsistent pattern, but keep increasing during December 2020 until February 2021. For the forecasting data, which is from May 2021 until July 2021, we can see that the data is inconsistent, and the forecasting for the day incident of COVID-19 in Selangor State had been made by using the best selected model, which is SARIMA 101-111-12. Lastly, we go to the conclusion and recommendation. For conclusion, we can say that we are able to achieve all of our project objectives. First, we successfully apply our data in Box-Jenkins method. Second, we are able to determine the best suitable model in Box-Jenkins method, either ARIMA or SARIMA, for forecasting COVID-19 incident by using AIC, BIC, and Durbin Watson test. Third, we are able to make prediction for future cases of positive, recovery, and death incident of COVID-19 in Selangor State by using the best selected model. For recommendation, we can say that Box-Jenkins method is a suitable method for forecasting since the method can be used for the larger data, long-time series data and the data that has seasonality. But we also recommend another two methods which are GMDH, Group Method Data Handling, and ANN, Artificial Neural Network. This both method has shown that it can improve the forecasting capability of the model. And from the result from this both method, it is shown that outbreak curve is really close to the real cases.